It's about trying to get the patient or the person in front of the right person, the right healthcare professional who's best placed to meet their needs. Historically, it's always been, oh, you better see your GP about that, or you'll have to see your GP in order to get referred on to A, B or C. Whereas it makes a lot more sense if patients can get to the person that's going to give them that advice or that help or care more directly without that kind of a hurdle.
Our receptionists are all fully trained to ask the right questions to know which person would be the right person for them to go to. So we do have to ask patients to please give as much information as possible. Some patients don't like to give any information at all, and unfortunately that does end up with the patients getting booked in with the wrong person and then using up maybe a GP appointment when actually it could have gone to one of our nurse practitioners, it could have gone to the physiotherapist, and that appointment with the GP could have been freed up with someone else. Give the information to receptionists as much as you can so that they can give you the right person to deal with that problem.
You can now consult with your GP from home or work by visiting your practice website.
We've got this e-consult system which has been a really great help. It is intuitive, so it asks the right questions for patient symptoms. We then have a long list, hundreds of e-consults that our admin people will go through.
We're working on clinical ones rather than the administration ones at the moment.
And the clinical ones, they will read it and then put them in with the right person. So the advantage for the patient is they don't have to sit on the phone for 40 minutes, which we appreciate is a long waiting list at the time at the moment on the phones. But they can sit and do it in the comfort of their home or on the bus to work or on the train to work. And there's the convenience factor.
It's actually steering them in the right direction. And I think rather than saying no, that you can't see your GP, it's about saying actually there's a positive choice you can make here. There are other people that can help. They should be wanting to see this whole variety of different roles who can all give something different.